good afternoon, Dr. Mike. So I read the article you sent me, Why French Women Don't Pee Their Pants, and fascinating. I would like to delve into it a little bit more with our audience because I think they will find it fascinating. And we will put a link at the comments below so that way you can actually read the article as well, because I think you will find American medicine likes to be a little bit more reactive and not proactive. Isn't that correct, Dr. Mike?
You're absolutely right. You know, it's funny, if you want a great Google, and this is what I tell all my patients, Google these exact words: why French women don't pee their pants when they laugh and you do. And that's the exact title of the article. And it's funny, right? why do all of us American women, and even some American men, they can't laugh anymore? We made a joke about it on, some of our Netflix, comedies, like, oh, don't make me laugh, you're gonna make me pee my pants. And the reality is that that's really a problem.
And if we stop peeing our pants, those incontinence garment companies would go out of business. They make it seem so normal when it's not.
It's so funny. You go into to any grocery store and there's an entire row dedicated to all of these different, diapers, and that's what they're diapers. They might be pretty, they might have roses on them, but at the end of the day, they're diapers, right? And so French women, this is interesting, and this is one of the things that in my research that I've done when I was comparing American medicine versus European medicine. And you said it exactly. It's about reactive versus proactive. So when we talk about this article, we're talking about the European style of being proactive with problems. Okay, and I'm going to cough a little bit because I swallowed wrong. Okay, so the article says why French women don't pee their pants when they laugh and you do. And it says specifically on here, after giving birth, we don't get access to free pelvic floor work like the mothers in France. So what's a Canadian gal to do? This should infuriate you even more, because what this is French Canadian women complaining that they don't have what French women are given. And remember, French in Canada, it's socialized medicine as well. And American women and American doctors have no idea what this is, because France, and to some extent, the complaint that Canadian women are giving, is that they are reactive to a problem that occurred when birth happened. That every woman is given this opportunity to re-educate a muscle group that's been essentially pulled and stretched and cut and tore, and all of these different things that have happened, right? So what is it that French women get, and what do they do in that we don't do here in the United States? And why don't we do it is the question. So let's answer the why first. You hit it on the nail. In American medicine, we need a diagnosis. A diagnosis. We need something wrong, a symptom, to be able to justify us being able to issue a treatment. Not very proactive, almost essentially reactive. The second problem is there's just not a lot of people who understand what is going on to be able to fix it. So they even have a problem with this in France, where there's just not a lot of pelvic floor rehabilitation doctors that exist. We have a tendency to lean more towards surgeries and stuff like that in this country, and they don't do that in other countries. So right off the bat, we have to have a symptom. And I know that one of the things that we talk about on this channel a lot is the bulbocavinosa reflex test, the very system that we sell with Mazon, from a company called Euroval. And that test is able to determine if the nerves are damaged or not, which will tell us proactively if there's going to be symptoms down the road after the birth has happened, and more importantly, at that postpartum visit, the 6 to 8 weeks after baby's born. That is a test that should probably be done on every single American woman every single time that a baby's born at that postpartum visit to be able to determine if there was nerve damage. And if there is nerve damage, because let's face it, you guys just pooped out of football, you know, us guys,
Three
yeah,
footballs.
I'm telling you, us guys, we would need a lot more than 6 weeks, 8 weeks. We'd be in traction for a year if that happened to us. So, I have nothing but respect and marvel for you ladies that have to go through that thing that we keep calling this wonderful thing of birth. But the reality is at that postpartum visit, doesn't it make a lot of sense to check the nerves and maybe even the muscles of that system to find out if they're functioning as good as they were pre-baby, right? And if they're not, we should assign, similar to the French, a some form of pelvic floor re-education or physical therapy or rehabilitation, which is one of the things that I do in my clinics. So if you go through some of the things they talk about, I love the very first part of this. In France, any woman who has delivered a baby gets a prescription for 10 free physical therapy sessions to re-educate her pelvic floor. Because you know what? It's been uneducated, right? It's been ripped apart and all over the
Oh,
place.
yes.
So we want to re-educate that collection of muscles, tendons, and all the different little parts that are made up of our pelvic floor that support all of those pelvic organs that are there, which include your bladder and your rectum. So when we talk about that part of the body and what the bulbocavenosa reflex tests for, it's pee, poop, and sex. It's voiding dysfunction, fecal dysfunction, and sexual dysfunction. The three things that a lot of women have after giving birth and have a tendency to not really report it as a problem because they think it's a part of, it'll get better. I'm young, that kind of thing. And if the
And we
nerves are
hear
truly
that all
damaged,
the time, and the commercials tell us that. I mean, we're socialized to think, oh, you've had a baby, or oh, you're getting older. That's normal. And it's not normal. And that's what we're here to help educate people on. It is not normal.
absolutely. Those symptoms are actual symptoms. They're diagnoses. So if you're a medical professional on this channel, listening to what we say, there are DX codes specifically for that then completely justify the rationale behind testing to see if it's nerve related. So guess what? Even though symptoms aren't there, we test a nerve. The nerve is not firing properly. We know symptoms are coming. And that nerve delay that might show up on one of these particular assessment tests are very valuable in determining whether or not they should assign, like the French, 10, and I'd love to say free physical therapy sessions. And we call it, there's some PTs that do pelvic floor. I'm a rehabilitationist, so I do pelvic floor, PFR, pelvic floor rehabilitation within my clinics. But anything to help that system because clearly there's an issue, right? So, the appointments you generally start around 6 weeks, around the 6 week point. Are you hearing that in the background? Is
Nope,
that
keep going. Well, you're
we're
good.
good? Okay. Maybe we can cut that out on the edit, right? So it's very interesting. This article that is again Canadian women, not even American women, Canadian women complaining that they don't have this access. It specifically says in here, in France, most women do it. In France, this is the norm, right? So Caroline Muller, what they call a physiotherapist in Paris who specializes in pelvic floor and prenatal rehabilitation. Most of them have talked to their friends who have done it, their moms that have done it, or their grandmas and tell them to do it because they have problems controlling their urine.
Wow, it dates that far back that they've been doing this.
Apparently, they've been doing this for a
That
long
is
time.
amazing, and we're just starting to learn about pelvic floor therapy.
I
You don't hear it very often here. It's just starting now to become much more, popular as a treatment.
even the concept of a physiotherapist is not really. It'd be on the lines of almost a kind of a chiropractor in how they would be viewed by the other medical professionals, even though we're really talking about something that in our country and in most countries these types of people that make our systems work better and work on systems of the body are really very much needed, very, very much needed. So, it talks a little bit about what the appointments are. They are a lot more I won't say invasive, but a much more hands-on in France than we are here in the States. But I can talk about a little bit about what I do in a pelvic floor rehabilitation therapy session. So basically what it is we first do one of these bulbar cavernosa reflexes. We need to assess the nerve so that I can have a baseline to know where that nerve is at. Then a person comes to see me between 8 and 10 visits, similar to the French. And I do something called a manometry with EMG, which allows me to confirm that you're using the proper muscles to squeeze and that you've got control of those muscles without spasm, and that you've actually got strength and control. And then with that, I assign exercises that you do at home that mimic what you can physically do in the clinic. You do those exercises, the next week you come back, and I see if those exercises have made a difference or not. I also do electrical TENS, which we've got a white paper from UNLV Medical that talks about that electrical TENS, that we found kind of the holy grail of the pelvic floor system on what actually works for electrically tensing or opening up those nerves using electrical TENS to be able to get those nerves to open up properly. A lot of people are using hertz frequencies that are not appropriate for that area because they just don't understand the technology or how it works. But that's another aspect of what they do in Europe and how they've kind of really figured this out. And we are just on that very front lines of exploring this as an option, even though the diagnosis codes exist, the CPT codes exist. If you have a diagnosis, you're allowed to have this. And almost every insurance company that I've ever worked with covers this, but no doctors know about it.
And it's also great because from what we were talking about, you have your first screening, and then you can go through the therapy, screen again, see if it's improved or not. So that way you find out, are you going to need to change direction on therapy, or are you going to then maybe refer at that point to urogyn or urology, or it helps you with what the next steps in progression will be, or now you have something that, hey, they've gone back to where they need to be.
Yeah, one of the keys to the bulbar cavernosa reflex system, and that's one of the things that I think would be interesting to see if that American technology would fit almost even better in France and European nations than it does the United States, because the United States doesn't really seem to understand what that is, and the French really do. But in therapy, every 4 weeks, I have to prove that the therapy that I'm working is working. And one of the nice things about a bulbar cavernosa reflex test is whether or not I'm doing PTNS or I'm doing pelvic floor rehab or whatever my treatment strategy is, I can have that baseline test. I do half of the sessions of treatment. I do another test to confirm that the treatment neurologically is working. And then if it is working, I continue the treatment on, and then I do a final test to confirm from the first test to the final test how well I did as a therapist or as a rehabilitationist to be able to get my patient to where their nerves are firing correctly. Because one of the things we found is that doing standard biofeedback, which is really just more muscles than it is really anything else, that doesn't seem to give long-lasting results. But a neurological improvement gives long-lasting results. We follow patients for up to 2 years at the School of Medicine after doing our pelvic floor, using that BRS or the Uraval as a guided process. And we were able to determine what we did in therapy lasted beyond the 2-year mark for most of the patients that we had, giving us about a 95% satisfaction level. So,
I'm sorry, go right ahead.
It was a fix. We fixed them.
And can you explain what PTNS or PTPN?
Yeah. So it's post tibial nerve stimulation.
There we go. PTNS.
We're actually using a very small, it's like an acupuncture needle to access the sacral nerve in the left or right leg. And it's actually in the ankle of the left or right leg. And we're actually stimulating the pedonal nerve electrically by putting a needle in your ankle and directly tapping your nerve, and then electrifying the needle into the nerve and then up into the bladder. So we're fixing your bladder through your ankle. And I know that sounds crazy, but it actually is a really good treatment. They've created an entire new modulation therapy that they're surgically putting into people's ankles for the sole purpose of duplicating that, on a surgical level.
Well, I've done
Um,
acupuncture, so I completely believe it. So
yeah, it's not acupuncture. It's just using acupuncture needle to access the nerve and then to create that electrical direct stimulation into the nerve. But what's interesting is one of the problems that we had with that is you don't know if it's the left side of your body or the right side of your body. You're putting it in both ankles, but each one of those nerves don't go into a generalized nerve bundle until they get to your spine. So to help, you might have the left leg, for example, where that nerve is perfectly fine controlling your bladder, and the right leg is completely messed up. But if you don't know that, and you're putting it on the left leg and not the right, you're not helping that patient very much.
and
So
that
it's
actually brings us to a good point. Can you explain for those who aren't familiar, and this might be their first time watching us, how the Uravel BRS is actually done on a patient? How quick, how easy, no electrical stimuli, no non-invasive, how
yep.
it is, and what we expect to find when we do the screening.
So a bulbocavenosa reflex test used to be a very invasive test, and it used to be a very painful test. We used to use needles. We used to have to stick our finger in bad places and try to find reactions. This is what we're taught in medical school to this day. Very, very difficult test. The
And if your
bulbocavenosa,
finger isn't as sensitive as the doctor next door,
right?
you're
Yeah,
feeling something completely different.
right. Some people have different size fingers, shall we say, than
Yes.
others. And I actually know to this day a nurse practitioner does this on every one of her patients. So I showed her, I said, hey, there is a system out there that is very nice. It has a very good reimbursement, but you know what? It can do those tests to help your patient and get that diagnosis that you need without doing all these horrible things to our patients that we did before, right? So the way the Uraval BRS or BCR system works is that we are using a mechanical stem. It's a little probe similar to this. I don't know if you can see that or
Yep.
not.
Yep.
Got the blur going on. And we're basically tapping the outside of the body. And when we tap, we get a response. This mechanical stimulation that I do, actually it causes a response in the rectum, and the rectum gives us a squeeze. We put two little stickers around the rectum, we do that little tap, and we get a squeeze. This is exactly what happens when your doctor goes and takes a hammer and bangs on your elbow, and you get a response. So we're doing that down there. We're banging outside of the body, we're getting a response,
And it's
and
not
that
really bang.
response,
It's like if you were to take a pen
yeah,
and stick it
it's
onto your hand is
yeah,
all you
yeah. I
feel.
shouldn't call it bang, right? It's a tap.
Nobody
It's a
wants that.
tap. It's a tap on the outside of the body. It is it's not painful at all. Not even a little bit, and it gives us this latency, what we call latency time. That time, anything less than 45 milliseconds, right, is normal. But if I click and then there's a response, there's a later than 45 millisecond response, that tells me that that nerve somewhere along the path is not functioning properly, which can lead to these problems. So when we just had, based on the French women scenario, a lady who just had birth with someone, would it make sense to do a nerve test down there where you just had that traumatic event happen? And then with that test, should you assign them some physical therapy, just like the French do on every single woman that has a baby? Shouldn't we do the same in the United States? And all the codes are in place, all the diagnosis codes are in place. Why we don't do it is the question that I will leave to the viewers and to the doctors who don't, and the people that haven't strategized to this. And I'd love to hear some comments on people, like why this isn't done.
And
I'd
we're
love to
not
hear.
here to tell the physicians also to make this clear. This is for you and your patient to be able to discuss once you have that latency time. what you want to do moving forward. So we're
Right.
not here to do any of that. Um, so I just wanted to be.
I'm not trying to tell you how to practice your medicine, but I would ask the question, why? And if you're a patient who just went through a traumatic birth, you should be asking questions why too. In fact, I think that's one of the videos that we're planning on doing is 5 questions to ask your urologist if you're a woman, 5
Yeah.
questions to ask your urologist if you're a man, 5 questions to ask if you have ED, 5 questions to ask if you have urinary incontinence or stress incontinence. So that's why I think this channel and the creation of this channel makes a lot of sense. There's a lot of not doctors who need to be asking the right questions and really taking their own personal health, keeping it to them and finding out, ways to fix the problem. So that's my take on it.
I want to thank you for your time today, Dr. Mike, and I want to thank you again for watching today. We look forward to seeing you back with our next video, and have a great day.
Sounds great. Thank you, everybody. Have a great day.